At the State House in Augusta, lawmakers were together today for a children's caucus to discuss better ways to fund early education and child care systems here in Maine.
News Center Maine's Caroline LaCour was also in that meeting. She joins us live now with details on what lawmakers learned today. Caroline?
Yeah, good evening, Brian and Amanda. It's no secret that many Maine families are struggling to keep up with the cost of childcare and early education. And the same goes for providers who are struggling to stay in business. Lawmakers here in Augusta are trying to now find the root cause of both of those issues.
It's like any other service in the state. The cost keeps going up. Childcare providers have to raise their rates.
As a mother of three, State Representative Nina Milliken of Blue Hill says she gets it.
And families can't afford to do that. It's unreasonable. No, there are very few jobs in this state, mine included, that don't cover that enormous expense.
To address issues within Maine's early child care systems, lawmakers like Milliken are holding a caucus to hear from experts in the field.
Yes, so our center works with states and communities all across the country to address a really thorny problem.
That takes hard work. Teresa Hawley is the executive director of the Center for Early Learning Funding Equity. She says a cost modeling study of Maine shows the problem lies with how the state is reimbursing families through the Child Care Affordability Program.
Parents can't afford to pay and teachers can't afford to stay.
Market-based reimbursement rates mean the cost of childcare varies in part based on which Maine county you live in. But she says changing the way rates are calculated could help even things out.
In the current system, not all their days are covered through reimbursement, so there might be some certain days that child is out that the program would not get reimbursed for.
Advocates and lawmakers are also keeping an eye on a bill called an Act to Ensure Subsidy Reimbursements and Emergency Financial Assistance for certain child care providers. If passed, child care providers would be reimbursed based on enrollment, not by attendance.
We often use the public school comparison. You know, public schools would get publicly funded regardless of the days kids are there. We want the same public funding for this subsidy program.
The bill would also set aside an emergency fund for child care centers as a safety net, but those who oppose the idea say it would be too costly.
It seems like if you have a child care center and your furnace goes out, that'll close you because you don't have the savings or the income.
If the bill does pass, child care centers could tap into that fund, something supporters say could prevent more closures.
Obviously, it's going to cost money, but it's money that these folks deserve to make.
Now, Bill LD 2199, who Representative Milliken just mentioned, has already passed unanimously through the Committee on Health and Human Services. Brian and Amanda, I'll toss it back to you.
Caroline LaCour live for us in Augusta. Thank you, Caroline.